automatically enrolled in Medicare. And because fewer people are automatically enrolled in Medicare, people have to take steps to affirmatively enroll. Now, to understand Medicare, you have to understand the 4 letters of the Medicare alphabet. Part A is your hospital insurance. It's your inpatient benefit. And Part B is your medical insurance, your outpatient benefit, your doctor visits, your lab work, your preventive care, your physical therapy visits. Together, Part A and Part B comprise original traditional Medicare, sometimes referred to as fee-for-service Medicare, sometimes referred to by people as government Medicare. The other way to get Medicare is through Medicare Part C. That stands for Medicare Advantage plans like HMOs and PPOs. These plans, which you see advertised on television, especially now during the annual enrollment period, which is running from October 15th until December 7th. If somebody is not muted, please mute. These Medicare Advantage plans bundle your Part A, Part B benefit together, and also offer Part D prescription drug coverage all in one plan. And then finally, everybody is entitled to prescription drug coverage, whether they're in original traditional Medicare or whether they're in a Medicare Advantage plan. Now, each part of Medicare has different rules for enrolling, has different monthly premiums, has different deductibles, and different co-insurance or co-pays. And I want to reinforce, and I'll be doing this throughout the presentation, the 2 and the only 2 ways to get Medicare: original Medicare, Part A hospital insurance, Part B medical insurance, Part D prescription drug coverage, or Medicare Advantage plans, which combine Parts A, B, and D into one plan. Now, what are the differences between your choices in Medicare? With original traditional Medicare, you have more provider choice and more complete coverage. Why? Because you can go to any Medicare provider in the United States, Puerto Rico, or the US Virgin Islands, or in the Pacific territories that accepts Medicare. But in exchange for this flexibility, to not only go to any doctor, but any facility, it may require additional premiums for supplemental insurance and for prescription drug coverage if you don't have any other, like retiree benefits or union benefits, or if you don't have Medicaid or some other program that assists with these out-of-pocket costs. The other way to get Medicare is through Medicare Advantage plans. These are private health plans that contract with Medicare. By law, they must provide the same benefits, the same basic benefits that Medicare provides, but they're also able to offer additional benefits. These plans are different because they have provider networks and they have a pre-approval process for high-cost procedures, typically like CT scans, MRIs, surgery, various forms of therapy that involve multiple visits. If you use the doctors in the network, you will get the greatest amount of benefits. If you're in an HMO, a health maintenance organization, which we'll discuss a little later on, you have to use the doctors in the network, and you also most likely have to get all your referrals from your primary care provider. With Medicare Advantage plans, you'll pay as you go. In other words, you'll pay co-pays and need a deductible. You may have co-insurance as you use healthcare. So the less you use healthcare, the less out-of-pocket you have. But the more you use healthcare, the greater out-of-pocket you will have. And as I will show you later, depending upon your personal health, there are big choices to be made between original Medicare and Medicare Advantage, which impact how much financial liability you may have. And Medicare Advantage plans are also allowed to provide you with extra benefits. And these are benefits like dental and vision and hearing that we'll talk about in a little greater detail as we get into the presentation. So now let's focus on enrollment. The initial enrollment period is the big enrollment period for Medicare. This is when you first become eligible, typically when you're age 65, although people who are declared disabled by the Social Security Administration can get on Medicare at any age. This initial enrollment period consists of a 7-month window that surrounds your 65th birthday. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after.
Hey, got a tough email.
You need to mute. Somebody's not muted.
You've got to follow up. You've got to follow.
Okay, thank you. If you enroll in the first 3 months before your 65th birthday, your coverage will begin the first of your birthday month. If you enroll during the month of your 65th birthday, your coverage will begin the first of the following month. Now, currently, we're getting to the end of 2022. Up until now, if you delayed enrollment until either of the last 3 months of the 7-month window, there would be an additional delay in when your Medicare coverage would start. This is changing in 2023, and that's what I'm going to focus on. So in 2023, if you enroll in the month after your 65th birthday, your coverage will start the first of the following month. And even if you enroll in either of the last 2 months of the 7-month window, your coverage will again begin the first of the following month. This is the result of legislation that was passed back in 2020 that is now going into effect in 2023 to simplify enrollment. And by simplifying enrollment and eliminating unnecessary delays, it reduces the chances that people will be subject to what is known as a Part B late enrollment penalty. If you go any 12-month period without Part B when you're supposed to have Part B, a penalty of 10% will be levied for every year going forward, in addition to having to pay your standard monthly premium. So the good news is that starting on January 1st, there will no longer be delays in enrolling during the initial enrollment period based upon the month in which you enroll in. Now, for people who miss the initial enrollment period, every year there's a general enrollment period from January 1st to March 31st. Up until 2023, if you enrolled in either of these 3 months, your coverage didn't start until July. So there was a several-month gap in coverage, and that helped push people into this penalty situation. But again, starting in 2023, if you enroll in either January, February, or March during the general enrollment period, your coverage will begin the first of the following month. Finally, many people today are working beyond the age of 65. And if you're working for a large employer, typically an employer with 20 or more employees, and you're covered by that employer's health insurance, either through your own employment or through a spouse, but it cannot be a domestic partner, it must be through a spouse, you're allowed to delay enrollment with Medicare without any penalty. And then when you decide to retire, you can have a 3-month period before your retirement date or 8 months following your retirement date where you're allowed to enroll in Medicare Part B without any penalty. That's the special enrollment period, and it only applies for people who continue to work beyond age 65 for a large employer, 20 or more employees, that offers health insurance either through their own employment or through employment of a spouse. Before I go any further, I will pause and ask if there are any questions so far.
If someone already has Medicare, then the enrollment period does
Okay.
not apply?
Excuse me?
If someone already has Medicare,
Yes.
does this enrollment period apply to us?
No, this is only for people who are not yet on Medicare.
Okay,
Because remember, at the beginning of the presentation, I said I would cover both for people who are not yet on Medicare, as well as for people who are already on Medicare. So if you're already on Medicare, you don't have to worry about that. So when you do apply for Medicare and when you are enrolled, you'll get this red, white, and blue health insurance card from Medicare. And if you remember, about 3 years ago, your Social Security number used to be on this card. It is no longer on your card. Now you have your own unique alphanumeric number. And it also tells you when your Part A coverage began and when your Part B coverage began. Now, the one takeaway about original traditional Medicare that I want you to pay attention to from this presentation is it's not free. Medicare has big gaps in coverage. And if you don't have a supplemental plan or some other form of assistance, you can be on the hook for a lot of out-of-pocket costs. So we're going to start first with the deductible and the premium for Medicare Part B. On the left side of this slide, for 2022, we see that the monthly premium is $170.10. And the annual deductible that you first have to meet before your 20% coinsurance starts is $233. I'll get to this last category shortly. In 2023, your monthly premium is going down. It's going down from $170.10 to $164.90. And when the premium goes down, the deductible goes down. So the deductible is also going to go down $7 to $226. About 93% of the population that's on Medicare will pay the $164.90 next year. About 7% who earn over a certain income threshold are subject to what's known as the income-related monthly adjustment amount. They will pay a greater share for their monthly Part B premium. For 2023, the limit is $97,000 for single filers and $194,000 for joint filers. If what is known as your modified adjusted gross income, which is your adjusted gross income plus any tax-free interest deductions added back in, exceeds this amount from 2 years ago, which is the tax return that the Social Security Administration looks at, you will be subject to the IRMA amounts, which I will show you shortly. When we go to this slide, this shows for 2023, the premium at $164.90. You can see here in the middle column, you see the dollar threshold for single filers and joint filers. And as the income goes up, as you go down the left-hand column, you'll see that the monthly premium goes up, and it can go up all the way to $560.50, which corresponds to individuals earning $500,000 or married couples filing jointly earning $750,000. You will also see on the right-hand column that there are surcharges for Part D prescription drug plans as well, based upon the higher income. Now, for a certain number of people, while they're working, their income is typically a lot higher than when they retire. And sometimes they get caught where they become Medicare eligible, and yet the Social Security Administration is looking 2 years back, and they're saying that they owe these extra premium amounts because when they were working, their income was higher. There is an appeal process to the Social Security Administration for certain life-changing events, and retiring is considered a life-changing event. And you can appeal to the Social Security Administration to use your most recent tax return, not the tax return from 2 years ago, to recalculate your exposure to the IRMA. And if the Social Security finds in your favor and grants you the appeal, then your IRMA can either be lowered or reduced, depending upon what your income numbers are. And if you're entitled to any reimbursement, you would get a reimbursement as well. If you fall into this category, the form to look for online is Social Security Form 44. That's the form that you have to affirmatively file. Social Security will not do this automatically for you. And that form lists the various life-changing events that qualify to have your IRMA recalculated. Does anybody have any questions about IRMA? Okay, if you do, you can unmute, or you can put a question in the chat and Erin can read it for me. Okay, so let's talk about the Part B deductible and Part B coinsurance. Your Part B deductible will be $226 in 2023. And once you meet that deductible, you're subject to Medicare's Part B coinsurance, which is 20% for most services. That means that Medicare typically pays 80%. You're responsible for the other 20%, and that other 20% is most often picked up by some form of supplemental insurance, either through a retiree benefit or through a privately purchased supplemental plan referred to as Medigap, because it covers the gaps that Medicare doesn't cover. And we'll talk about Medigap plans in greater detail shortly. Laboratory tests are not subject to either the deductible or the coinsurance, and most preventive services, so long as you get them within the prescribed time intervals, are also not subject to deductible or coinsurance. Medicare offers several preventive services, several preventive screenings at no additional cost. We strongly advise you to take advantage of them. In order to understand how Medicare coinsurance works, we need to spend a moment or two talking about the concept of assignment and participation, because there are two different types of Medicare providers. The good news is that about 97% of Medicare providers are what are known as participating providers. A participating provider accepts assignment. That means that they accept what Medicare pays them as payment in full, except for your 20% coinsurance. They will file the claim for you for the visit with Medicare, and then the claim will be sent to any supplemental insurance that you provided to the office. Participating providers, providers who accept assignment. Where can you find participating providers? How do you know if your doctor is a participating provider? You can ask the office. You can go on www.medicare.gov and look up the provider. If the provider is participating, it will say accepts assignment. Or you can call 1-800-MEDICARE, which is available 24/7. Now, about 2% of providers do not accept assignment for all claims. They are referred to as non-participating providers, but they are still in the Medicare program. They can choose whether or not to accept assignment or not, because they have not signed a participation agreement with Medicare that gives them a certain guaranteed level of reimbursement. But non-participating providers just can't charge anything they want. They are limited federally by a 15% cap and further limited in New York State by a 5% cap on everything except home and office visits. So in New York State, if you saw a non-participating provider for a surgical procedure, they're allowed to charge an additional 5% over and above what Medicare typically charges. To make this very simple, if a procedure was $100, Medicare would cover $80. With a participating provider, you would pay the other $20. If you went to a non-participating provider, they could charge up to an additional $15. So the visit would be $115, for example. You would still be responsible for the $20 of the coinsurance, with Medicare paying $80, but you'd also be responsible for the additional $15. That is typically paid for by certain supplemental plans. Plans F and G in the Medigap universe, which we'll talk about shortly, cover these what are known as excess Part B charges. So I just want to make sure that everybody understands that while the great majority of providers in the Medicare world are known as participating providers and accept assignment and file the claim for you, non-participating providers have a choice whether to accept assignment or not. If they don't accept assignment, they're allowed to charge a little bit more for their services. And finally, there's a class of providers, the other 1% or so, who have opted out of the Medicare program. They are not part of the Medicare program. They cannot bill Medicare for 2 years, and they can charge anything they want. So the way you would know that you're with an opted out provider is that by law, they are required to give you a contract up front that tells you we are not in the Medicare program. Medicare will not cover our services, neither will your supplemental plan. If you want to have services provided by us, you will be charged what our going rate is. Typically, the greatest amount of opted out providers tend to be in the mental health field: psychiatrists, psychologists, social workers. So this is the universe of Medicare providers, and this is how Medicare coinsurance works. Now, if there's anything about original traditional Medicare, which we're currently discussing, that illustrates how important it is to have supplemental insurance, it's Part A out-of-pocket costs, the costs that are associated with inpatient care. When you go into the hospital, there is an initial deductible. In 2023, it will be $1,600. And in exchange for that, you get your first 60 days of hospitalization. If you need an additional 30 days, there's a coinsurance of $400 per day. And if you need another 60 days beyond that, there are what are known as lifetime reserve days with a coinsurance of $800 per day. If you go into a skilled nursing facility after the first 20 days, if it's still medically necessary that you be there, days 21 through 100 have a $200 copay. On the bottom, it talks about the Part A monthly premium. Part A is premium free for about 99% of the population, because either you or your spouse has paid into the Social Security system for 10 years or 40 quarters, so you get Part A premium free. If you didn't work for 10 years, or your spouse didn't work for 10 years, and you're not entitled to premium free Part A, it's about 1% of the population. There are various numbers based upon how much you did pay in that represent what you would pay for your monthly premium. But this slide really shows the out-of-pocket costs that you can rack up if you don't have any kind of supplemental insurance. And you could potentially have more than one deductible with Part A during the course of the year, based upon how frequently you go in and out of hospitals and how long it's been since your last hospital discharge. Again, when you have supplemental insurance, these numbers are just not really on your radar because it's being paid behind the scenes by supplemental insurance. But if you don't have supplemental insurance, this illustrates how expensive regular traditional Medicare can be without this additional coverage. Who hasn't seen this ad? I would suspect that virtually all of you have seen this ad on television, and especially now that we're in the annual open enrollment period, where people can either stay in original Medicare or go to Medicare Advantage, or go from Medicare Advantage back to original Medicare, or change their Medicare Advantage plan, or change their Part D drug plan. We're inundated with ads like this, not only on television, but also in the mail. And you'll see celebrities like Joe Namath on this slide, or George Foreman, or Jimmy Walker, or even William Shatner, now that he's truly back from outer space. And they're talking about all of these wonderful benefits that you may be missing out on, and you need to rush to call an 800 number and tell them your zip code. What these plans are doing, they will, if you call the 800 number, the ads will link you to insurance agent that sell Medicare Advantage plans. This is the other way to get Medicare. And we'll be discussing Medicare Advantage plan shortly. Now, I just want to take a moment and take a look at the chat. I see a question from Barbara. Is all hospitalization covered if provider and hospital is participating? Your hospitalization is covered by Medicare, providing, if you're talking about covered being, are all your costs covered? They're covered if you have supplemental insurance or some other form of insurance that covers the gaps that Medicare doesn't cover. Remember, Medicare covers a certain amount, and then you're responsible for a certain amount. If you're hospitalized and you're seen by participating providers, then you'll have a co-insurance that will be covered by virtually all of the Medigap supplemental plans without any cost sharing. If you're seen in the hospital by some providers who are not participating, there may be some extra out-of-pocket charges that you would have to pay depending upon what supplemental plan that you have. Now, the benefits that I just talked about, that these 800 numbers and these television ads are touting, are benefits that are not included in original traditional Medicare. I'll say that again. The benefits that you see on this slide are not included in original traditional Medicare. They may be included with certain limitations and certain restrictions and perhaps annual dollar amounts by Medicare Advantage plans, but each Medicare Advantage plan will differ. There are two exceptions on this slide, and they have asterisks. The first exception is with vision and eyeglasses. Medicare will pay, original Medicare will pay for one pair of prescription eyeglasses following cataract surgery. That is the only Medicare coverage of eyeglasses. Medicare also doesn't provide what's typically referred to by some people as a comprehensive annual physical exam. Medicare does provide an annual wellness exam at no cost to you. And during this wellness exam, the physician will review your personal medical history, your family medical history, will do your vital signs, will order any blood work if it's required, will refer you to any specialists if necessary. But any of those additional referrals, such as to specialists, or such as if the doctor wants an electrocardiogram, for example, or some other form of diagnostic test, may involve copays and after you meet your deductible. But the routine annual wellness exam is a free exam with no out-of-pocket charge every year for Medicare beneficiaries after you've been in Medicare for 1 year. Original Medicare does not cover services outside the United States. It doesn't cover long-term care. Some people confuse that with Medicaid. Doesn't cover hearing aids, doesn't cover dental care, doesn't cover things like gym memberships or hot meals that may be provided by some Medicare Advantage plans after an inpatient hospitalization. It doesn't provide routine medical transportation to and from doctor visits. Some Medicare Advantage plans may provide that. Some may also give you debit cards to use in pharmacies or in grocery stores. Those are Medicare Advantage plans. We'll talk about them shortly. It's not original traditional Medicare. So now, having spent time talking about and repeating how expensive original traditional Medicare can be with out-of-pocket costs, let's talk about one of the ways to deal with those costs, which is through Medigap supplemental insurance. Again, coming back to your Medicare choices: original Medicare, hospital insurance, medical insurance, prescription drug coverage, Medicare Advantage plans bundling everything together. We'll discuss these in greater detail shortly. And now we're going to talk about supplemental insurance, a Medigap policy or retiree group health plan that picks up the extra out-of-pocket expenses. There are 10 Medigap plans that are lettered A through N, and it is a standard benefit. They're sold by private insurance companies that are regulated by each state. It doesn't matter which insurance company is selling these plans. If a Plan N is sold by one insurance company, it's no different from a Plan N sold by another in terms of the benefits it provides. The only thing that differs is the plan price and the monthly premium. And you can see that all the plans cover that Part A coinsurance, days 61 through 90 that we talked about, that had that $400 per day coinsurance. They cover the 60 lifetime reserve days that had the $800 per day coinsurance. And they also give you an extra 365 days of hospitalization. And all cover the Part A deductible, which will be $1,600 next year, except for Medigap Plan A. And don't confuse Medigap Plan A or Medigap Plan B with Medicare Part A and Part B, two totally separate things. Most of these plans cover the entire 20% coinsurance that you're responsible for doctor visits under Part B. And we talked about that earlier. And we talked about how with some non-participating providers, if you're seen by a non-participating provider, that coinsurance could be a little bit more, up to 15% more. Two of the plans, F and G, cover those excess charges. New York State is a great state to live in when it comes to buying a Medigap plan. Why? Because we have continuous open enrollment, meaning that you can enroll in a plan at any time, and you cannot be turned down for age. You cannot be turned down for your health. You could, however, be subject to a waiting period of up to 6 months for pre-existing conditions. But if you have other type of health coverage, like a different Medigap plan, a Medicare Advantage plan, coverage from the Veterans Administration, coverage from an employer, etc., that counts towards eliminating the waiting period, so long as there has been no break of 63 days or more in continuous coverage. I will make a copy of these slides in PDF format available to Erin after the presentation. So it will contain things like this website link below, where you can get all the latest pricing for these Medigap plans. One important thing to note: if you first became newly eligible for Medicare in 2020 or later, it doesn't mean you had to be on Medicare, but you first became eligible, you're no longer allowed to buy Plan C or Plan F. Alternatively, you can buy Plan G, and I'll show you the difference next. This is a chart of the 10 different Medigap supplemental plans. And you can see the letters across the top line here. And you'll see under Plan F and Plan G that most of the boxes are filled in. In fact, all of the boxes are filled in for Plan F, which is the most comprehensive plan, because in addition to all the benefits, Plan F also pays your annual Part B deductible, which is going to be $226 next year. So they cover that. Plan G gives you everything that Plan F gives you, except for the Part B deductible. And you'll see that both Plan F and Plan G cover Part B excess charges, which are the charges that get incurred if you use a non-participating provider. So these are the two most comprehensive plans, and typically they are the most expensive plans, which I'll show you what these typical costs are in the next slide. People who want to try to save a little bit of money on their monthly premium for a Medigap supplemental plan often gravitate to Plan N. This is one of the other very popular plans. So what's the difference between Plan N and Plan G, for example? Well, you see there are two asterisks here next to where it says basic benefit. This involves the 20% coinsurance that you're subject to for doctor visits under Part B. With plans F and G, that 20% coinsurance is paid in full. It's covered in full. With a Plan N, you're responsible for up to a maximum of $20 per visit. It's cost sharing. In exchange for that little bit of cost sharing, you typically have a monthly premium, an annual premium for Plan N that's several $100s less than the annual premiums for Plan F and Plan G. You'll also see that Plan N does not cover Part B excess charges if you go to a non-participating physician. But as we talked about earlier, by calling the doctor's office in advance, or by checking on www.medicare.gov, or by calling 1-800-Medicare, you can pretty much stay with doctors who are participating, the great majority, the 97% of the doctors who accept Medicare. And so Part B excess charges may not be that much of an issue for you. The only other major difference with Plan N is if you go to the emergency room, there's a $50 copay. Should you be admitted to the hospital, that copay is waived. There are other plans like K, L, and M, and you can see that there is some cost sharing involved, whether you're in the hospital or with a doctor visit under Part B and with skilled nursing insurance. So these plans will have lower premiums, but you're agreeing to shoulder some of the costs along with the plan. And then these plans set annual out-of-pocket limits beyond which the plan will cover everything. So again, these come down to personal choices of finances and how comprehensive a coverage you're able to afford to buy or that you want to buy. So this is a chart of the latest prices, and we're not going to spend too much time here, but I'm just going to illustrate one thing for you. A lot of people ask, what's better, Plan F or Plan G? And as I showed you on the previous slide, the only difference between F and G is that F covers the $226 deductible next year, and the $233 deductible this year. But we're just looking at United Healthcare here, AARP. Here's one of the insurance companies that sells these plans. You can see there are several others here. Transamerica Financial right next to, a little less expensive. In this situation, it costs $40 more for a Plan F per month than Plan G. And if you multiply that by 12, that's $480 more for the year. And even if you went to Transamerica Financial, it's $25 more, the difference between 306 and 281. $25 more a month is $300 more a year. What is that $300 more a year getting you if you buy the more expensive Plan F? It's getting you the deductible. But if the deductible next year is $226, you've got $74 left over in savings if you bought Plan G, even if you had to pay the deductible, because you're paying $300 less in premium. Okay, so the point in doing this is to show you that by comparison shoppings, you can save a lot of money even with the same plan, because look over here. Look under Bankers Conseco. A Plan F is $729.96 a month compared to $306. That's more than double. It's the same Plan F. And in New York, where you cannot be denied coverage, where there is no medical underwriting for Medigap supplemental plans, this is a big incentive to comparison shop your plans from time to time to see if you can't get a better buy and save yourself some money. I'm going to pause for a moment and ask if there are any questions about Medigap supplemental plans. Okay, again, back to our chart to reinforce that there are two and only two ways to get Medicare: original Medicare or Medicare Advantage plans. Again, what's different? Regular Medicare, you can go to any provider you want, any facility you want that accepts Medicare. It'll likely cost you more upfront because you'll have to pay a premium for a supplemental plan in the absence of a retiree benefit, as well as a Part D drug plan. Or Medicare Advantage plans with their provider networks, their pre-approval process, higher cost sharing because you pay as you go, but lower upfront costs, and you may get extra benefits. So now let's talk about Medicare Advantage. In order to be eligible for Medicare Advantage, you have to have both Medicare Part A and Part B, and you have to live in the service area of the plan, which is where the plan operates. You can enroll now. We're in the annual enrollment period from October 15th to December 7th. And you're also given another 3 months to enroll between January 1st and March 31st. And during this period, you can change a Medicare Advantage plan, or you can come back to original Medicare. Medicare Advantage plans have to cover by law at least what Medicare covers, but they're allowed to give you additional benefits. And they have fixed co-payments or co-insurance for most of their services. They're more of a pay-as-you-go type of health plan. There are two basic types. One's the health maintenance organization. This is the most restrictive type of Medicare Advantage plan. It provides in-network benefits only. If your doctor's not in the network and it's not a bona fide emergency, this plan will not provide you with any coverage. Some have a limited point of service option known as an HMO POS, where they have some services available outside their doctor network, but it could be something like some limited dental care, for example. It may not even relate to medical care. These are the Medicare Advantage plans that tend to have no additional monthly premium. Remember that everybody, regardless of whether you're in regular Medicare or Medicare Advantage, has to pay the monthly premium for Part B, which is going to be $164.90 for most people next year. With these health maintenance organizations, you typically need to get a referral to see a specialist from your primary care provider. Now, if your doctors are in the network, and if the hospitals or physical therapy facilities, for example, that you would like to use are in the network, health maintenance organizations can be a big financial benefit to people who don't want to pay the $200 or $300 or more out of pocket for monthly supplemental plans with original traditional Medicare. The other form of Medicare Advantage plans are the preferred provider organizations, or PPO. These are much more flexible than HMOs because they allow you to go out of the network and you can see any doctor that accepts Medicare, but you will typically pay more in the form of higher copays. Preferred provider organizations are the type of Medicare Advantage plan you want to be in if you travel. So for snowbirds, for example, who go to Florida or Arizona or someplace further south than New York, and you want to get routine medical care throughout the year, you would want to be in a preferred provider organization, because even though you'll pay more if the doctor is not in your network in your snowbird state, at least you know that regular care is covered, not just bona fide emergency care. So health maintenance organizations, preferred provider organizations, two types of Medicare Advantage plans, one far more restrictive than the other. This is a very important slide. Remember, a few minutes ago, I showed you the Medigap supplemental plans. I showed you the rate chart, and I showed you that you could buy the most comprehensive plans, F or G, for somewhere around $300 a month or $3,600 a year. You cannot buy a supplemental plan if you have a Medicare Advantage plan, because they have their own separate cost structure and they have their own separate maximum out-of-pocket limit, abbreviated as MOOP or MOOP. So what is that limit? Look at the red on the bottom of this slide. $8,300 a year if you stay in the network and you use doctors who are contracted with the plan, up to $12,400, $450 if you go both in and out of the network. $8,300 in, $12,450 out, compared to original traditional Medicare, where a supplement will cost you about $3,600 a month and give you full coverage for all Medicare covered services. And even if we throw in the $226 deductible next year, let's round the $3,600 up to $4,000 so that we can make an easier comparison. If you need a lot of medical care, if you're in and out of hospitals, in and out of doctor visits, in and out of specialty visits, in and out of therapy, original traditional Medicare may be a better buy for you because you will have less out-of-pocket potential expenses than with a Medicare Advantage plan where your financial exposure can run all the way up to $8,300 in network or $12,450 in and out of network. An important point to remember when you're selecting between the two plans. Typically, the healthier you are and the fewer visits that you make during the year, many people then gravitate to Medicare Advantage plans because with no additional premium and no $300 or more monthly premium to pay for supplemental plans, people are ahead financially if they don't use a lot of healthcare. Now, if during the year something changes and your healthcare suddenly deteriorates and you need a lot of care, you'll be in whatever Medicare Advantage plan you chose for the balance of that year until the annual enrollment period at the end of the year, which we're in now, where you could change and either pick a different plan or go back to original traditional Medicare. Let me just go back and ask if there are any questions about Medicare Advantage plans. Okay, now regardless of how you get your Medicare, whether through original traditional Medicare or through a Medicare Advantage plan, you're entitled to prescription drug coverage. It's optional, it's voluntary, but if you don't have it when you're supposed to have it, for every month that you don't have it, there is a penalty that gets added on to all future premiums that you pay. In New York State this year, there are 19 separate standalone prescription drug plans, and there'll be the same number next year. Each of these plans has their own formulary, which is the drugs that they'll cover. They have their own pharmacy networks, which is where you'll get the best pricing. They have their own pricing levels, known as tiers, that set the copays for generics and brand name drugs. They have their own policies with regards to whether or not they require pre-authorization from your physician to get a certain drug. You can enroll just like with Medicare supplemental plans, just like with Medicare Advantage plans right now during the enrollment period that runs every year from October 15th to December 7th. And in a moment or two, we'll talk about some special enrollment periods. Now, I don't want to go into too much detail about how these plans work behind the scenes, but there are three separate phases where the costs to you differ with a prescription drug plan. Most plans have a deductible, and the maximum deductible allowable next year is $505. And in the initial phase, you'll typically have to pay out of pocket until you meet your deductible, but there are some low-cost generics that many plans don't charge the deductible for. There's no copay for them. Once you meet the deductible, you go into the initial coverage limit phase, and this phase counts all your drug spending up to $4,660. And during this phase, the plan has a specific copay structure for generic and brand name drugs. And then when your out-of-pocket costs reach $7,400, you go into what is known as catastrophic coverage. With catastrophic coverage, the plan pays 95% of the cost of the drug and you pay 5%. There is another phase in here between $4,660 and $7,400 where you'll typically pay 25% of the cost of the drug and the plan will pay 75%. All of this gets explained to you when you get your explanation of benefits from being in a Part D plan. And you can compare your plans at www.medicare.gov. The Medicare website is a very user-friendly website that enables you each year to put whatever prescription drugs you're taking into the plan finder. You put down the name of the drug, the dosage, and how frequently you take it. You list up to 5 pharmacies that you can access, including mail order, and the plan finder will tell you what the least expensive plans are and where the best prices are in the pharmacies that you selected. It is a very valuable tool. In any given year, about 50% of Medicare beneficiaries are in the same plan that they initially signed up for when they first became eligible for Part D. And for some people, that goes all the way back to 2006 when the program first started. In any given year, only about 5% of people who are in Part D prescription drug plans are in the plan that can save them the most money. Last year, for example, I was counseling a beneficiary who took a lot of drugs and was complaining to me that her out-of-pocket costs were over $10,000 a year. By looking at the plan finder and by examining all the different plans, we were able to save her about $8,000 annually in drug costs because we found a plan for her that had the best pricing for the greatest number of drugs that she was taking compared to other plans. People leave a lot of money on the table with prescription drug costs, especially if they're taking several different prescription drugs, by not taking the time to comparison shop their plans. If you're not comfortable with going on the website or with calling 1-800-Medicare, you can also call a HIICAP counselor. We talked about that at the very top of the presentation at 212-602-4180, and a HIICAP counselor can assist you. They can't tell you which specific plan to buy, but they can give you enough information to make you an educated consumer so that you can make a wise choice with the plans. Now, at the beginning of the presentation on the second slide, I showed you that one of the things we're going to talk about are programs that can help certain people that have certain incomes with extra help, with assistance with paying for out-of-pocket Medicare drug costs, and with Medicare premiums. There are 3 programs I want to talk about: Extra Help, which is known as the Low Income Subsidy, LIS, EPIC, and the Medicare Savings Program. Extra Help is a program administered by the Social Security Administration for people whose incomes fit these limits. And again, I can provide a copy of the slides, so I'm not going to read off these limits. Extra Help also has an asset limit as well. And this is what stops many people. Okay. Now, Extra Help has 2 forms: full extra help and partial extra help. Full extra help provides greater assistance than partial extra help, but if you qualify, you can get your Part D drug premium paid, and you can get your copays capped at very low levels. If you think you fit into any of these categories income-wise, either for full extra help or partial extra help, you should contact a HIICAP counselor who can help you apply for this program. But there's another program that we're going to talk about in a couple of minutes that lets you get full extra help, doesn't have an asset test, and has much higher asset limits. It takes a little longer to apply for and a little longer to get, but it can provide these benefits, and it can offer a backdoor way into getting extra help if your income is higher than these limits or if you've got higher assets. First program I'm going to talk about after Extra Help is EPIC. EPIC is a state pharmaceutical assistance program. And every pharmacy in the city should be familiar with EPIC. You're eligible for EPIC if your income as a single filer is $75,000 a year or less, or $100,000 a year or less as a joint filer. EPIC has a fee plan for people who are in income levels up to about $23,000 a year. And for everybody above that, there is a deductible to meet. For people in the deductible plan, there is no fee for EPIC, it's free. We recommend that everybody who's eligible sign up for EPIC. Why? Because EPIC will cap your copay at a maximum of $20 per prescription. And in addition to that, EPIC will give you an additional special enrollment period, that's the abbreviation SEP, to switch your Part D plan. So why is that important? Well, supposing you start the year relatively healthy, and then it's April or May, and something happens and you have a serious illness. And along with that serious illness is a need to take 4 or 5 or 6 very expensive drugs, maybe brand name drugs. The particular drug plan that you're in at the start of the year may not be the best plan for you to be in for the rest of the year, given your change in medications. But without a special enrollment period, you'd have to wait until the end of the year, until October 15th to December 7th, to apply for a new Part D plan to start the first of the following year. Epic gives you a free look and a free opportunity to switch drug plans one time during the year at any time during the year. It's a very valuable benefit. You cannot apply for Epic online. You can download a fillable application, however, and you can either mail it in or fax it in, or you can apply to Epic through this 1-800 number. Now, the big program I want to talk to you about today is the Medicare Savings Program, because New York State, as you'll see in the lower right-hand quadrant here, is going to be significantly raising the income limits in 2023 when compared to 2022 for qualifying for the Medicare Savings Program, and especially for the last category, which is the qualified individual. So as you can see, and these are estimates for 2023, but the numbers we expect are going to be very close, that they're going up about $600 for individuals from 2022 and about $800 for couples. What does this program give you? If you qualify for the Medicare Savings Program under these QI income limits, you get your monthly Part B premium of $164.90 paid, and you're automatically enrolled in full extra help, meaning your Part D premium will also be paid, and you'll also have much lower copays. If you qualify for the qualified Medicare beneficiary QMB program with these income limits, and again, there are no asset limits here, unlike with the low income subsidy. If you qualify here, QMB will not only pay your Part B deductible, will not only give you full extra help and pay your Part D, your Part B premium, will also pay your Part D premium, both B and D premiums. It will also cover your deductible and it will cover your co-insurance. QMB acts as if you had a supplemental plan that is very comprehensive, that provides full coverage. If you think you qualify or you will qualify for Medicare Savings Programs, contact the HIICAP counselor now so that we can get you ready to apply for the program and be ready for it in 2023. And please do the same if you know somebody, if you have a friend or a relative who might be in a situation where they can benefit from this program, because there are some tremendous benefits to be had from the Medicare Savings Program. So what else is going to be new in 2023 and beyond? You may have heard that not too long ago, a piece of legislation passed known as the Inflation Reduction Act. The Inflation Reduction Act has many components to it, but we're only going to concentrate, obviously, on how it affects Medicare. In 2023, starting next year, all vaccines will be covered under Part D, and that includes the shingles vaccine. In 2023, starting next year, out-of-pocket costs for insulin will be limited to $35 a month and will not be subject to the Part D plan deductible. Some people right now who are diabetic are paying $200 to $300 a month for their insulin supplies. In 2023, it's going to start being capped at $35 a month. The full extra help program that I showed you that had pretty rigid income and asset limits, those limits are going to be expanded in 2024. In 2024, I talked about that after you spent about $7,000 out of pocket in drug costs with prescription drug plans, that you had a 5% cost share. It's going to go to 0 in 2024. And now here comes the biggest benefit of all. In 2025, there will be a new maximum out-of-pocket limit for Part D prescription drug costs of $2,000 for the benefit year. $2,000. So people who are paying $5,000, $6,000, $8,000, $10,000 a year, people who are in the donut hole, people who are in catastrophic coverage, you will be limited out-of-pocket cost $2,000. The amount will be subject to being adjusted each year for inflation. And as an added benefit, people will be able to spread the $2,000 limit across monthly payments. And the limit does not include the monthly plan premium. That's separate. And finally, there's one other new thing coming as a result of the Inflation Reduction Act that's not on this slide, and that is starting in 2026, Medicare for the first time ever will be allowed to begin negotiating prices of certain high-cost drugs with the pharmaceutical industry. It'll initially start with 10 drugs in the first year, and then 15 drugs will be added in each subsequent year. Also, starting in 2024, the Medicare Part D drug plans, the companies that sell these plans, will be limited to a 6% cap per year on their insurance premiums for the monthly Part D premium, excuse me. Right now, some plans double their premiums from one year to another for their Part D plans. And if you're not aware, if you're not paying attention, if you don't look at the annual notice of change that is mailed to you around this time of the year by prescription drug plans, that tells you whether or not the plan is continuing, that tells you what the new plan premium will be, it tells you whether or not certain drugs will no longer be covered, you could get caught being in the same plan, but all of a sudden find that your premium may have doubled. By having the premium increases capped at 6% per year, that will help mitigate some of this unwanted sticker shock. Now, if there's anybody on the call who is a New York City retiree, you're aware that there's been a lot going on in the past year about the city attempting to change the retiree no-cost benefit for the supplement from a GHI emblem supplement at no cost to a Medicare Advantage plan. And you're also aware that there was a court action, so there is a temporary stay on this, with the one change that your GHI emblem senior care program now has $15 copays for visits. This situation is far from over. We don't have any additional information to share, but we strongly encourage you that you stay in contact with your union representative, your health benefits advisor representative, that you go on the Office of Labor Relations website periodically to see if there are any updates, and that you read the news, because the city is still negotiating to try and do something like this coming down the road for New York City retirees. But at the present time, everybody gets to stay in their same plan while all of these things are worked out legally behind the scenes. If anybody has any questions, this is the HIICAP number to call for HIICAP counselors, 212-602-4180. That concludes the formal presentation, and I'm happy to stay on for a little bit afterwards to see if there are any other questions in the chat.
I only see a couple of questions here. I think, not sure if you had seen these. One is about hospitalizations, but I think you already
We
discussed
answered that.
that.
I think
You did.
you can apply, asking about the MSP deadline, you could apply at
Mhm.
any time for the Medicare Savings Program. There's no deadline. I think we covered all the rest, and I'll be able to get you the PDF version of the slides that you can share with your clients.
Yes, we will provide to everybody that was on the call today. Once I receive the slides, we'll send that to you. So this way you have it as your reference.
Great. So if there are no additional questions, I always end with people ask me what's the best plan to choose. And the standard answer is eat a little healthier, get a little more exercise, take advantage of preventive benefits. That's the best plan to be in. And so with that, if there are no more questions, I just want to wish everybody a happy Thanksgiving and a happy holiday season, and thank you for the invitation. It was my pleasure to be able to present today. And remember that HIICAP counselors are ready to help you if you need the assistance. So thank you.
Thank you so much, Dr. Kunkin.
Thank you.
Oh, sorry, Lori, go ahead.
Oh, I just want to say thank you. I think you were really clear and kept everybody in order.
This is healthcare is very, very complex. And we encourage you to look on the Department for the Aging website for Medicare orientation sessions, which are 90-minute sessions that we provide twice a month. one in the morning, one in the afternoon. Sometimes you really need to hear this 3 or 4 times for it to start sinking in into registering. So if anybody feels overwhelmed by the information, please don't. It takes a lot of time to digest this.
Well, thank you again. We really
Okay, well,
appreciate
thank you,
it.
everybody. I'm going to sign off now, and everybody be well.